Assalamu alaikum. Thank you all for attending this webinar. This is in a series of medical webinars run by APPS, Association of Pakistani Physicians and Surgeons based in UK. Our aim is to promote education and awareness on health issues. My name is Shaista Meraj and I'm a radiologist working in UK. This webinar is on communication skills. Communication is the key to personal and career success. It is an art that you can learn. Your knowledge and experience is important, but it's the communication skills which will set you apart. Your success will be determined to a degree by your academic credentials and your professional experience, but up to 80% of your success will be down to your communication skills. We have our panelists here who will be talking to us on communication skills and emotional intelligence over the next hour. Can I ask you to please introduce yourself? Dr. Abdul Hafiz? Sorry, you're on mute.
Sorry for that. My name is Dr. Abdul Hafiz. I'm a GP by profession, based in Greater Manchester. I'm also working as the CEO of the organization. Thank you.
Thank you. Dr. Ansar Hayat?
My name is Dr. Ansar Hayat, and I'm a GP and a family doctor in Wakefield, West Yorkshire. And I'm also clinical tutor for University of Leeds medical school undergraduate students.
Thank you. Dr. Masood Ahmed?
Thank you. I'm Dr. Masood Ahmed, and I am the Chief Medical Officer for the Black Country and West Birmingham CCGs.
Thank you. Dr. Nabil Sami, please. You might be on mute. Okay, we continue with Dr. Irfan Rashid while Dr. Nabil Sami comes back.
Thank you, Shaista. Irfan Rashid. I'm a GP in Bradford and also a pediatrician with a special interest in pediatrics. I am a social secretary of ABS UK and executive council member of Amica UK, which is a alumni of Allama Iqbal Medical College in United Kingdom. Thank you.
Thank you very much. Dr. Nabil Sami, please.
I'm Dr. Nabil Sami. I'm a graduate of Buckeye Medical College, currently working here in Canada as an instructor with the Ontario IMG School for their various board review courses for the USMLE, the PLAB, and the Medical Council of Canada. I have a fair bit of experience working with IMGs when it comes to communication skills, as I've also been an examiner with the school at the Whiteman Barris Academy for the OSCEs.
Thank you very much. It's great to have all of you here. So Dr. Abdul Hafiz will start the session. Dr. Irfan is looking at the Facebook live streaming.
Yeah, it's going live on Facebook. I think whoever is listening to us, they can share it so others can benefit as well from this presentation.
Thank you very much. Thank you for joining. Communication skills, as has been said rightly before, is a very powerful tool, but it's quite underused, especially in third world countries. And me being a graduate from Pakistan, I think the emphasis of communication is not as much it should be. And there are many students and doctors who actually come to take the postgraduate exams, lab exams, and so on, and then they struggle in some of these barriers. So the aim of today's session is actually to, just to highlight some of the areas of communication. We cannot cover everything about communication, and we can never be mastered just by listening to a talk. So the aim is we actually inspire you guys out there, we understand some of the areas which we commonly use in UK, and we have some very strong panel members here who will be touching on different parts of the communication and so on. So our aim is to actually give you an insight into advanced communication skills. But in the beginning, I will just set the scene, just more about the basics of communication, and then obviously we'll take things forward from there. Okay, so the areas which I'm going to talk about today, about any sort of encounter which we have between patients, between colleagues, and in general in society, the emotional aspect, a little bit about empathy, sensitivity, and then the barriers to effective communication. The first important point, which we quite underestimate many times, is the first impression. First impression about any person is the most difficult thing to change. However, when we look at the data in terms of how long does it take for somebody to make an impression about you, is only 7 seconds. So before you have a single word or any communication has happened, an impression has been made about you, which can be between, when you go for an interview, between, your employer and, yourself, you between one friend with another friend, a colleague with another colleague, and similarly between you and the patient. When patient enters your clinical room, even before they have said anything, you make an impression about the person. Early, patients also make an impression about you as well. So you go, you walk to the waiting room, you call the patient in, and then people watch, people very carefully see how you are actually walking, your body language, your posture, the words you choose, and the confidence you show is an impression. But it only takes 7 seconds. So something which actually comes only within second is the most difficult thing to change in your life. I think we quite a lot of times underestimate this. And the overall impression which a person make about you, 7% of this is the words, and 93% are other things. So the scene which I'm showing you 2 pictures. Let's focus on the right screen. The 3, 4, 5 people standing. Okay, so each one of them has a different body posture, and each of them are sending signals. So if I just ask you to think, if these 5 people are standing, who would you approach? Who do you think? All of them are smiley faces, angry or anxious or anything. Okay, they're all smiley faces, but even then, we have made an impression about all of them within seconds. Okay, so personally speaking, if we just analyze the body language a little bit more, so the gentleman on the left, obviously he's just standing on one leg. The lady next to her, obviously again is putting all her weight on one leg, but she has, closed arms. The person in the middle has open arms, equal smile. 4th person has hands in the pocket. And the last person again. So obviously one of those people who you would think, I think that seemed like more approachable person, and you will be confident, you'll feel easy to go and speak. And to me, that person is the one in the middle. And I think there is one person where you feel, no, maybe last person if I have to go and speak to that person. Okay, but all that is the signals of communication which are verbal, which we are getting from them. Okay, let's now focus on the people who are sitting in chairs. Okay, so again, from one side to the other, each of them is sending a separate signal. So if you're sitting somewhere, irrespective of where you can, I think all of you will agree, but the person who is most approachable, friendly is the one on the extreme right of that. So just to give you an idea in terms of the first impressions. Okay, next we move on to actually what communication is. Okay. Communication is transfer of knowledge, transfer of information between individuals. There are different types of communication. We can do a written communication. It can be in the form of verbal, sign language, via email, via letter, and so on. So all those things are, different ways how we communicate with each other. 90% of communication is body language. So we've discussed that briefly, but if you now focus on the pictures which are next to the text here, each of them separate signals, and body language never tells lies. And I think a lot of times we see people raise hands think this is not considered as a good signal, within the medical world or even in the business world. That means you are a closed person, you are hiding something, and obviously people feel uncomfortable to come and speak to you. And this happens sometimes. If you ask somebody a question, how many children do you have? And the person actually answers you the question, but at the same time folds the hand. That means this is a no-go zone. Person doesn't want to talk on that particular topic. So very important to pick that sign. How do babies communicate? Okay, they never utter a word, but even then, mom can actually say when baby is hungry, when baby needs nappy change, when baby needs, baby is in pain, and there is something more to it. And when patients tell us, when pediatricians speak to them, and they are quite good at it, the mom actually says this cry is something different. So it's a different signal which is actually coming to us. So essentially, obviously, I don't want to go into much detail. Body language is in itself a full 1 hour webinar, and we might actually do this at a later stage. But if we just focus quickly on these images now on the side, the top image, you can see on the left side, the person with crossed arms is actually very defensive. Doesn't to speak. And the person on the other side, on the right-hand side, hands on the hips. This is a very aggressive posture. People don't like that either. So what we really want is hand on the sides facing, in a natural, neutral position. That's the person who is open, who is, easy to communicate with. And similarly, in the bottom screen, if you see the lady, again, closed body posture. The reason I'm spending too much time on this particular slide is because I've seen many people who come to UK from other countries. They do not pay attention to this, but indirectly, a big signal is going to your employer, your consultant, when you are talking in a particular way. Okay. Next element of communication is the emotional content. Okay, we discussed body language is important, but apart from body language, obviously, is the actual words which patient use. But we sometimes confuse the emotional content. And if we actually can understand what the emotions are with that particular word, then it's easy to manage it. And first, recognition is important. Okay, so patient can say some things, for example, when they are very angry about something, and patient can, give you a signal which can be just a body language. If you look at the images, the top image is, again, we can say that he's happy. The second image in the middle says things are escalating. Person is actually giving you a strong body language signal. And then obviously, if we do not do the right things in this whole series, then we end up having a fight or major disaster, which can actually hurt people, hurt doctors, and so on. So essentially, this is important to recognize right at the first stage. Let me give you an example. Okay, a patient might come to you and say, doctor, you gave me, for example, a particular medication, let's say penicillin, and I'm allergic to it. Okay, so patient is sitting back, patient is relaxed, giving you this statement. Another patient, he says exactly same words, but his tone of voice now different. He says, doctor, you gave me this medicine, I'm allergic to it. Just using exactly same words, but in a different tone of voice, we can immediately see this person is not happy. Or the third person can be even more aggressive. The person can actually be standing, okay? He's not even willing to sit down because of the anger, okay? So we have to recognize this emotion. Unless we recognize the emotional content of the conversation, the communication will be a disaster and you will not be able to do justice and do the right thing the patient. So in one line, again, it's a very big area, and I'm sure we will come back with communication and how to manage the emotions. The one line answer will be we mirror image. If person is relaxed, their tone of voice is low, we sort of not in a similar tone. And if patient is angry, then we have to show concern, because patient will keep repeating themselves until they feel the emotion has been passed over. Because if patient is angry and you just sit back and relax, it will just escalate anger and it will result in a fight or a disaster, which we don't want. Next two important points, I'm just going to touch briefly and move on. One is empathy. Empathy is a verbal response. which means that we can see or understand or try to understand the situation patient is in. Okay, so for example, if patient is in pain, patient will say, "Oh, doctor, I couldn't sleep last night." And this is very common in exam scenarios. So when a patient says, "I couldn't sleep last night," as a doctor, you should not be just sitting and just, muted and move on. You must acknowledge that. You must say, that must be very difficult, because that's empathy. It's a verbal response. And when patient is angry, we empathize, okay? And we have to use more and more. Again, sensitivity means we are actually putting ourselves in a patient situation when things go wrong. For example, how would you like your colleague to tell you that you made a clinical error? Okay, so do you want the person to be stand in the middle of the ward and shout at you? Or would you like this person to take you to in a side room, sit down, and then have a conversation in terms of what happened, give the person an opportunity to express themselves? So this is what we say. So we do exactly say we communicate, but in a very sensitive way. Again, very important skill for doctors and a winning formula in many situations. Okay, the main aim, my main message is on this screen. What are the barriers to having a good communication? Okay, number one, we can have, first barrier is the language. So if you don't know a particular language, for example, patients speak Italian, you don't know Italian, there will be an issue. Okay, but communication is much more than language. I think this is, we must differentiate that. Number two, emotions. When patient is in anger or doctor is angry, obviously you will not be able to have a nice, proper communication. For example, if you have a bad news in your life or something happened and you are sad, then the communication will not be effective. And obviously you will miss things, you will say things in a different tone, and that might mean differently. Another big issue is the workload. A lot of times we rush through patients and we obviously have lack of time. Things, for example, breaking bad news, which should be dealt with in a proper way, we try to rush through, and then there's a barrier and we can't do proper communication. A lot of times we don't listen. We, in conversation, we just give information, we just move on rather than actually giving person opportunity and trying to listen and understand what the patient means and what do they want. And once you actually go into the listening mode, a lot of problems will not arise. Similarly, inappropriate setting. Okay, there are certain things which have to be discussed in isolation, in privacy. So you cannot have every single discussion in an open, corridor or at the reception desk and so on. So you have to detect, how important is the conversation, keep the sensitivities in mind, keep the emotions of the person in mind, and set the scene before you actually go on to having any sort of effective communication. And then the mismatch in context. Maybe you're talking about something and patient thinks you're talking about something totally different. And that context has to be clarified conversation you're going to have about which situation, so you are on the same page. And then information overload. Okay, if you just sit with the patient and bombard them with all the information, obviously that would mean ineffective communication. Patient may not remember everything. You might think you have done everything right. You have taken consent by giving all information, but essentially this is your responsibility. That patient gives an informed consent, which means patient's understanding of information is doctor's responsibility, and you cannot walk away from that. And this is absolutely tested in the exam situations as well. Okay, and then a lot of times we make assumptions, and those assumptions can be, we think patient might already know all this, or patient is already aware of the bad news. So you need to know exactly where you are. And for example, knowing the context means sometimes if patient has, for example, dementia, and we adopt our communication to the setting, with the language we use, the tone, pace we use will be totally different. And then obviously we shouldn't assume that every patient is same and our communication is going to be same. Then awkward topics. Okay, so if it's somebody's personal problem, a female patient might feel awkward in talking about their issues with a male doctor. So again, that can actually have a barrier. And similarly, lack of cultural awareness, which is again a very big barrier, where doctors come from overseas to UK to give exams. There are certain norms here, and I think all these areas are going to be picked up later by my colleagues. So my take-home message, Communication is a skill that can be learned and it can be mastered. It takes time, okay? And it takes practice. It's like a dry test. You cannot learn it just by reading or watching a video. You need to practice. You need to reflect. You said something, see what happened, how the patient reacted, and can you do things differently next time? And that will make the biggest difference. And breakdown in communication is the major cause of complaints, as well as in complaints and claims against the doctors. Communications for those who work at it. Thank you.
Thank you very much, Dr. Hafiz. So when you break down the elements of communication, as Dr. Hafiz rightly mentioned, body language is most important. It's up to 55% is your body language when it comes down to your communication. Then 38% is your voice tone. And it's only 7% that comes down to spoken words. So it's important to carry yourself in a way that shows empathy. So our next panelist is Dr. Ansar Hayat, please. Thank you.
Thank you very much, Shaista, and thank you, Dr. Abdul Hafiz, for an excellent start of the communication skills. It is indeed a very important topic, and every time we have some encounter to the patient or some sort of a session like this, we always learn new skills. So I think this is an ongoing and is a dynamic process and an act and is an active process and not a passive thing to learn. So there are lots of areas of the communication skills that we might talk about. So I will only focus on a couple of areas, mainly on communication with colleagues. And communication with patients and their relatives, particularly breaking bad news. Because if there are any areas where there is a gap in the communication skills, it can lead to poor outcomes in the patient's treatment and the team working, and ultimately it can lead to complaints and litigations. So even if one or two team members are not performing well, then this can lead to a bad impression for the whole team. So it's very important that the communication skills are learned as a team. At whatever stage in your team you are, you can play your role. Whether you're a junior doctor, a consultant, or a GP, or a professor, it's very important to understand your team and always keep them motivated to work harder for the good patient care and talk to each other, and they should be motivated to do the work. So there are a few simple principles that I think we should also look for in order to have a good team spirit. One of the things I would like to say is that it is very important that we take care of talking about colleagues or scolding junior doctors, particularly in front of patients or other colleagues. It can give an impression of a poor care and also can be demoralizing for the particular person that you talk to in that sense. It's also very important that you give a great courtesy to all your team members, irrespective of their role in a team. And this is particularly important for some of our colleagues like myself and Abdul Hafiz. When we come from overseas, we see most of the time is the doctors who are playing the leading role, and usually the nursing colleagues and other people may not be consulted on many stages of the care. But it's very important you do involve them in the care, you do talk to them, you share what you think you're going to do with them, you ask their opinion, listen to them. And it's not only clinical colleagues and doctors or nurses, it is other support staff, which includes even porters or clerks in the ward who are providing you administrative support. It's very important to appreciate their role in the best patient care that they are delivering. And please give a lot of appreciation to people for the good work they've done. Everyone likes to be appreciated for the hard work they do. And if you have to give some criticism or some positive criticism where people can improve, it's perfectly fine to do that, but please do always in a sensitive manner, in a way that when a person is ready to listen and improve on the things. As a team leader, it's very important to lead by example and showing respect towards your colleagues and other people and help them do their job in a good way. One of the ways that we learned while working in the NHS is that to audit your behaviors and the team working skills through different feedback systems. For example, we have got a feedback system called MSF, which is a multi-source feedback, where a trainee or any doctor is really supposed to have a feedback from different people working around them. So it's like a 360-degree feedback. So you have to give the feedback cards to doctors, nurses, admin staff, and other people as well. So they should not be from the same trade or a category. So it's very important to have a wider feedback, which should be confidential and can be shared with the team member about their areas where they've done well and areas where they can improve. So team working is very important, and the communication in the teamwork is what keeps the team going. So another area which I thought is very important to cover as a part of the communication with the patient is the communication with patient's relatives and the family or attendant of the patient. This is really, really important area. And I think this is such an important area that we have seen that so many complaints and other problems that arise, particularly violence that we were talking about, myself and Dr. Abdul Hafiz were talking about violence towards patients, towards doctors in Pakistan and India and other countries is increasing, which is very concerning. And this has a great adverse impact on the direct patient care, because the doctors are concerned about their own safety in many situations. The causes for intolerance or violence towards the doctors are multifactorial, but one of the important thing I think is we must not lose the sight is the perhaps a lack of communication between the patient's family and the doctors, because the doctors may be doing their best to treat the patient who is very ill and sick, but no one has got the time to talk to the relative to explain what might be going on with the patient. They then might come up with an idea, we brought our patients absolutely fine, or you said he was fine, but now you say our patient is critically unwell or is dead. And then you can imagine the frustration and the anger that a patient family may have is very difficult to control. So it's very important to have some sort of skills or a strategy to manage them from the outset. So I think it's the few tips which I would like to share with you is that never be informal with them. So always have a formal discussion with them as you have with the patient, maybe once or twice a day, where you talk to them about the progress of the patient, the condition, what have you done, and how things might change. So they know that we are keeping them up to date with what's going on. I've seen in my practice that people like to be appreciated about the efforts they have made for their loved ones in the care, how they have been concerned, and you appreciate, I really tell a patient or a wife or a husband that I really appreciate that you're very concerned, you're doing a great job as a carer, you have brought him from so far. It must be hard for you to going through all this on your own or with this. We will do whatever we can do. And it's important to be truthful at the same time, not to give any false hope. So tell them the dynamic nature of the disease or the illness. They can change any time. As a doctor, we know that it's not always possible to predict the outcome in any particular condition. Every patient behaves so differently. So it's not, it's okay to say that the things might improve or might go downhill, but there is a real problem if we think everything will be fine. You just keep praying or like this. This is not something that we should say as a doctor. It's very important to give your independent and honest opinion about what might possibly happen. Another thing we have observed that patients' relatives use a lot of internet and the Google system these days to find the information about their illness, and they might come with many questions in their mind. So if they have any questions, it's perfectly fine to cover that with a more appropriate explanation supported by the evidence, the scientific evidence that we do have. Also, never express any shock as you didn't know. So it's very important to be open and be realistic that things may go wrong. Try to have a consent of most of the treatments that you are providing, including examination. So it's like a mental talking. So consent does not necessarily need to be in writing. It can be a verbal consent. For any treatment you are providing, it's a good practice to go through the pros and cons of any treatment, and that helps as a counseling. And if anything adverse side effects or an outcome happens, so at least the patients are aware that these are the things we discuss and can be expected. Despite whatever we do, there can be incidences when there will be difficult interactions with patients and doctors. The studies from the litigations show that about 15% of doctor-patient relationship end up as difficult encounters. So when we say difficult encounters, is that when the doctor or a patient is not happy with the process or the outcome of our relationship. So the satisfaction goes down. This is something could be multifactorial. So it's very difficult to say that one factor will cause it, and is usually as a result of imbalance between the expectations and the hopes and what can be done in any particular situation. So it can be due to something called a doctor factor, or a patient factor, or could be an external factor, some other resource issues like this. So doctors' factors, the common doctor factors are poor clinical knowledge, or we are very busy due to the lack of time. And as we have seen, particularly in a busy clinical settings, in accident emergency, outpatients, or in some of the countries when there is no actually appointment system, there may be so many people that you are waiting to be seen. So you can't spend too much time talking to people because there are many patients waiting to be seen. So you might have to be more like a doctor-focused rather than a patient-focused care. However, this is very important to keep a balance, because if you don't do that, then it's definitely lead to some of your cases as a difficult, and that may have an impact in the care of rest of the patients. And sometimes as a doctor, we come as a bias that we always perceive that this patient may be a difficult patient and may demand something that you can't do it and might put upset. Similarly, psychosocial issues, like just like an ordinary person, doctors may have problems in their own lives. There may be something going on in the family, could be some health issues, could be financial issues. So it's important to be aware of them as a doctor and seek appropriate help or advice from your colleagues or seniors. And the poor job satisfaction from the doctor's point of view is another thing which really can lead to poor interactions and the poor outcome of the clinical care. Then there are some patient factors that you may not have any control on it, but it's very important to be aware of them and manage them accordingly. For example, there are some patients who have chronic illnesses. They are aware of their conditions, and they perhaps are aware of the limitations what the doctors can do, but they are still dependent on doctors for advice and support and care. So it's important to listen to them, reassure them, and explain them what can be done and continue to offer the support if they need it. Sometimes patient may be aggressive, and then of course that puts you in a difficult situation. You may be scared or anxious, and sometimes you as a human being can be frustrated. But it's important to be aware of that the patients are usually not aggressive or agitated due to yourself. They are agitated or aggressive due to their own conditions and circumstances. So try to understand what's going on. Stay calm, listen to the patient, and offer the support that's needed. Sometimes maybe that the patients have searched so many things on the internet and they come with a fixed agenda. For example, only asking for a CT scan when you do not think is inappropriate. So in that situation, it may be that to sit again, listen to the concerns. They might have searched some internet and where have come some concerns about the cancer or anything or any other family experience. So it's important to listen to that, explain to the patients that what can be done and why the CT scan is helpful or not helpful in this particular situation. Then there may be some patients who have a history of anxiety, depression, or mental health issues. So whatever you do, they are still very worried about that there must be something wrong with the body. So you do all the tests, and sometimes you do worry and doubt even your own diagnosis. But it's important to be aware of these factors and signpost such patients to the appropriate psychological counseling or services. And as I said earlier on, in addition to these could be some circumstances where both as a doctor and a patient, you agree that this is something that can be done or could be done, but you couldn't do it due to lack of resources. So you can only explain in that situation, tell that that's the best thing that you could do or how further the help can be sought. And as Dr. Abdulhafiz told, there can be some barriers of the language and culture, which is very important to be aware of, and try to address them in an appropriate way if you can. Last thing which I would like to cover is the breaking bad news. This is another difficult task, which we all will encounter as a doctor. Unfortunately, we can't tell people good news all the time. There may be instances when you have to share some potentially bad news or a bad news with the patient. So how we define bad news is any news which can have a potentially a devastating influence on one's life is called bad news. It could be some terminal diagnosis or a cancer, or a heart attack, or someone even might have died that you have to disclose it to the next of kin. It's a very difficult task to just do for the first time. So it's very important to have a training, rehearse them, and get mentally prepared, and maybe take a colleague with you to support you if you have done it, if you're doing it for the first time or the initially. Once you are an experienced person, then you might feel comfortable to do that, but certainly it can be quite daunting for a junior doctor or if you are in a new clinical settings. There is a mnemonic, like a protocol that has been suggested that you could follow that in order to help you go through your steps. So it's called the SPIKES protocol. So SPIKES. So S stands for settings. So whenever you think that you have to talk to someone about breaking bad news, and it can be difficult for the patient to comprehend the news or understand, it's very important to have an appropriate setting where it is quiet and calm, and you are prepared mentally to deliver the news. So other team is aware that that's what you are going to do, so they don't keep interrupting you. If you have got a bleep, it's important to hand over your bleep to someone so they can answer it. Important to keep your phone on silent or switch them off. It's very important to have an appropriate eye contact. because that shows a confidence in you as a doctor. P stands for perception. So this is to assess the patient's prior knowledge about their condition. So we might assume that the patients have already know about their condition because you expect them, they have seen so many doctors and they might have told them. And actually, it is true that they have been told so many times, but we know that patients many times are so stressed when they go to outpatient appointments or see the doctors, they tend to forget many things. So it's always a good idea to start.
Dr. Rayat, we got only 1 minute, so the 2 other panelists as well. Sorry, just
no problem. That's fine. We're just going through the last slide almost. So hopefully,
brilliant. Thank you.
Yeah. So it's very important to assess their prior knowledge and the family members. And before we give them the information, is better to invite them to ask if they have any particular questions that they would like to ask. And while explaining these their condition to them, it's important to give them the initial warning if it's particularly bad news. For example, I'm afraid that I've got a bad news for you. So something that they're mentally prepared. And also when you are talking in a particular environment, they might have an idea that this is something serious coming on. Use a very simple language. So instead of cancer or a lesion of so many centimeters in the right upper lobe of the lung, it's better to use a very simple term that the tests show that you've got a tumor in the lung. So very simple language, non-technical language, check and chunks, so slow information giving and make sure that they are understanding this information. Another important thing is the emotions, that you can imagine that any patient that you tell the bad news, it's very likely they may be upset, and the emotions can vary from being very silent to angry and crying, or sometimes frustrated. So it's important to be prepared to behave in a professional way in that sense. Sometimes it's just be supportive and listen to the patients, making an emphatic statement or a gesture, allow them time to recover, and then carry on saying, I understand it must be very difficult, and then you can explain what you want to explain.
Great, thank you very much, Dr. Ansar. We're running short of time, so our next speaker is going to be Dr. Masood Ahmed, please.
Thank you.
Thank you.
Thank you.
Thank you for that introduction. So, as you've heard from my colleagues, communication is quite a complex area. And therefore, it's important to kind of delve a little bit deeper. I think as doctors, the key is going to be understanding the needs for communication. So I'm going to touch upon some of the background principles that support your approach to learning about communication skills. I'm going to touch upon seeking first to understand. I think that's really key, but also looking at intercultural communication, the written word, and how that applies as we move into, we're far more connected through IT and so on. So what we write reflects also what we're thinking. And then a little bit about nuance and intonation. I think that the seek first to understand is a quote from Stephen Covey and his book, The 7 Principles of Highly Effective People. And it's a really important one as doctors, because often what we do is we listen because we're getting ready to respond. And we're getting ready to give an answer, but actually we should be listening in order to understand. And that's the first step. If you can listen to understand, if you have that understanding with the patient, with your colleagues, it prepares you and makes your communication effective. And ultimately, that's what we're trying to do, is we're trying to be effective. Normally, there are 4 kinds of responses. And again, being able to understand the meaning of a conversation is important in how you're going to respond. You may be responding in a way where you're evaluating. So you're judging what's being said and therefore agreeing or disagreeing. Now, if that's the case, it's key that you pull out the facts and you arm yourself with enough information and context to give a full response. It may be that when you're talking to someone, you're not getting enough information and therefore your follow-up will be probing. And again, the manner in which you do that and the line you take will add to the information you have. It may be that you're advising, and certainly when you're advising someone or you're giving solutions to someone, then empathy plays a big part in emotional intelligence as well. and we'll be hearing a bit about emotional intelligence later, but in terms of the empathy, I think it was Dr. Noshin was asking, what do you do if you have an angry patient? And how do you connect? Well, part of it is ensuring that you've taken the first step so they bring their barriers down if someone is angry. And you acknowledge that by saying, I can see that you feel angry because of X, Y, or Z. Now, if they agree with you, as soon as someone says yes, actually what they're doing is they're lowering the barrier that is effectively blocking communication. And so that engagement is really key. And then you can sort of follow up. It may be that they're not angry. It may be that they're frustrated. At least if you reflect back to them what you were seeing and you said, I feel that, you know, it seems as if you feel, they can either acknowledge that or they can actually change the course of the conversation. But doing that at an early stage is important. And then interpreting, you know, part of your responses really comes from your own experiences. And I've been very fortunate in that in my career, I started off as a clinician, but over the last 10 years, I've been in a lot of different sort of leadership roles. I went into technology. I was the global medical director for Dell. I've also been the chief digital officer for the Health Innovation Network. And earlier in my career, I was a negotiator, a national negotiator for the British Medical Association. And so all of those experiences actually feed in to your concepts and how you manage communication. The other thing is that we're looking at this from the perspective of intercultural communication. And we often look at culture in a very basic way, in that, oh, we're from different countries. But actually, there are many different layers to intercultural communication. And that's because we have many different cultures. You know, it may be categorized by our nationality, by our ethnicity. It could be our religion. It could also be our gender. You know, the way in which you might talk in a group of men and a group of women is different. And generational. The language you use, the tone, what's appropriate, the etiquette. When you have different people at different generations talking, that also has an impact on communication. So understanding the environment within which you're communicating is very important. And as I mentioned before, we're now at a time where IT means that we're always messaging each other. And it's very easy, and I'm going to show you some examples, where what you write actually can be interpreted in different ways. And this goes back really to a concept that is often used, a metaphor, like a fish out of water, which actually describes this cross-cultural condition. And it's really important to recognize that really it takes time to understand the context you're in, the environment you're in, all the different layers. And those are the things that with experience and with practice, you become familiar with. I was talking a bit about the written word. Now, in terms of the written word, here are a couple of examples which when people write and respond, or even when they say these things through text or WhatsApp, they may not always mean what you think. You know, when you thank someone in advance, that's implying that I'm expecting this to be done. When you apologize for being unclear, that's a polite way of saying, I wasn't unclear. I don't think you read my original email or my original text. And therefore you're nudging someone to say that, look, actually, I'd like you to pay a bit more attention. I don't feel as if you're engaged in terms of this conversation. When you say, hope this helps, again, it could be innocent and it might be that you hope whatever you've said helps. But sometimes what you're saying is, look, I hope this helps. Can you please go and either do some extra research, go do extra reading, find out for yourself. Another term, let me clarify. That basically, you're saying that you should have paid attention. So these are all little things which may seem polite on the surface. And what I've seen is that a number of my colleagues who have come from overseas, their grammar and their vocabulary is fantastic. It's the context and it's the manner in which things are said that they don't always pick up on. And so these are the small things that, for myself, I was born and brought up in the UK. So for me, it's second nature. I don't think about it. I can see I can understand what someone's saying immediately. But for others, it may take a bit of time. Again, another few examples. I know we're a bit pushed for time, so I'm going to run through to this part. Now, nuance and intonation. Dr. Hayat mentioned this as well. It's really important because the manner in which you talk to someone can be interpreted in different ways. I'm going to give you an example. The sentence is, I never said I kissed your wife. Now, when you first hear that, you might think, well, okay, that's easy to interpret. However, if I say it in different ways, hopefully you'll see what I mean. I never said I kissed your wife. Now, does that mean that someone else has said it? I never said I kissed your wife. Well, does that mean I communicated something, but I didn't necessarily say it? I never said I kissed your wife. What does that mean? Someone else's wife? Again, it's very easy to change the meaning of the sentence just by the manner in which it's communicated. I never said I kissed your wife. Again, it may not be your wife, it may be someone else that you know, etc., etc. But I find that's a really good example that demonstrates the differences that can be created when you try and interpret language, and how you communicate effectively. It really comes down to you establishing a manner in which you kind of connect with people. And again, it starts with the listening part. You know, people often say we have 2 ears and 1 mouth for a reason. And I think that's true. Having been a clinician and worked with patients and colleagues, but also in the business world and with many different sort of stakeholders, all of these things become apparent. How do we improve? Well, actually, I think it just comes down to practice. And the more you practice, the more you get familiar. The other thing I would say is that for anyone that has come from overseas, comes to the UK, get feedback, talk to your colleagues, and don't be afraid for them to pick out small things in terms of the manner in which you communicate. One of the things that we've seen recently on LinkedIn is that it's got a name pronunciation option. So you can actually put your name in so that colleagues can see how do you pronounce your name. Another thing I would say is don't rely on movies and music, because while that sounds like it might be correct, you'll find that even within a single country, there are so many different nuances as you go from London to Scotland to, the Midlands, etc. So what I would say is practice, practice, practice. I know we're short of time, so I'm going to wrap up. Thank you very much.
Thank you very much for that, Dr. Ahmed. So it's important to understand various cultures when you are working in a place where you come across people from various religious backgrounds, various cultural backgrounds. So having cultural humility is very important. And also listening is important, as we've heard already. I'm a radiologist, so I get patients who are sent down to us for ultrasound and CT scans. And I know that doctors are rushed sometimes. They're not really listening. They're just not understanding what the patient is saying. The patient is actually telling you the diagnosis. And when they're already down in the ultrasound with us, everything is calm and we have time, we're talking to the patient, and they're actually telling us what's wrong with them. So if you listen to that, you won't be having trouble in managing the patients. And with that, we go on next to our next panelist, Dr. Nabil Sami, please.
Okay, so I'm going to be starting next. I'm going to share my slides here. Okay. So first of all, let's hold on just 1 second here. Fix that. Get back. All right, so what is emotional intelligence is the topic of my discussion today. All right, so you already had an introduction. Emotional intelligence, okay, basically is the ability to understand emotions, okay? And, you have to understand emotions of yourself, and you have to understand emotions of others, okay? So when you have to understand emotions of self, it requires emotions to be, in a manner that you are reflecting on them, okay? When it comes to others, you have to comprehend how they feel. You have to understand what their emotions are coming out to be. You also have to be aware of how these emotions affect others, okay? The short form that we can refer to emotional intelligence as EI. Now, there's this thing called two-way street, okay? And as a clinician and a patient, okay, there's a two-way street that's there. You probably heard of this term in Harper's Biochemistry and in Ilyas's textbook of community medicine, two-way street. This is the same thing. It's going to be recurring all throughout
Sorry, Dr. Sami, we can't see your slides. Can you...
I did put the share screen there. Hold on.
Do you mind trying it again, please? Yeah.
Yeah. How is that going through?
Yes, it's going through now. Yeah.
Yeah. I don't know what's going on. It's
So if you're in a slideshow, then it will go.
Yeah.
The end. Yeah.
Okay. So do you want me to start again, or do you want me to continue?
That's fine, I think. Yeah.
Yeah, so it's better. Yeah, thank you.
It's better now? Okay, so basically, you got down the definition, you got down the abbreviation, you got down the, both the denotation and the connotation, and of course you understood that it's a two-way street, okay? That, you have to give and you have to take. You have to take information, then you have to give back information. And the patient also has to take information and to give back information. So with that, that's the next step, okay? Now, why is EI important? Clinicians, okay, are faced with a difficult situation, okay, and, all the time, all right? They're not able to understand, okay, patients, all right? For example, patients are not able to comply with the medication. For example, in Canada, they may not be able to have drug plan insurance, or in the United States, they may not have adequate insurance. So they're not covered. Why? Because, for example, someone could be a student, okay, a pre-med student in university, and they may not be having a highly paying job. So they're not properly covered, okay, for like insulin-dependent diabetes. So you got to be able to be, a little bit empathetic in that sense, and begin to understand exactly what the situation the person is going through. Okay. The other thing is that we got to understand something about leadership. Okay. Leadership, okay, means that you're able to compose, okay, under stress, okay, and react. For example, if the team, okay, is losing out in a match or a game, rather than screaming, swearing, cursing, the coach actually sits down and composes himself, and in a manner that is acceptable and accessible to both the other team members and those who are out on the mat on the playing field, comes up with a solution. And sometimes the tides actually change. Now, finally, we got to talk about our doctors, okay, leaders. Doctors are leaders, yes, okay. Not every leader is a doctor, of course, we know that. You went through medical school to become a doctor, but okay, all doctors are leaders in their own right, okay? So the essence of being a doctor is to be a teacher, okay? So you have to impart, okay, but you have to lead. But does that mean to be didactic? Absolutely not. It means to actually be dynamic. In the clinical practice and the context of modern Western medicine, okay, you have to rely on something known as assisted learning, whereby you have to facilitate patients, okay, because they are able to think for themselves, okay, for the most part, all right? They're able to go through informed consent and informed decision-making because they're of sound body and sound mind, okay? And they're able to, therefore, receive and understand information and relay it back to you in many ways. Now, you also have to understand that the patient, okay, is no longer an uninformed individual. They have all the tools at their disposal now. With the advent of the cell phone, the mobile phone, the internet, the cable TV, dish TV, we have now started to see a revolution at which the world is at their fingertips. So don't underestimate the patient, okay, at any point that they don't have it, okay? So you have to have your own feelings, but you have to understand their feelings and their emotions based on what information they also have. Okay, now there's a lot of traditional vantage points. Now, as medical students we're taught in med school, hide your emotions, bury them, put them down 6 feet down under, okay? Medical school, okay, in Pakistan is undergraduate entry, and of course here in the West, in the North American construct in the United States and Canada, it's graduate entry. And they have also continued this journey after internship and residency and the fellowship that, bury these emotions. Well, this is not really a good thing, okay? And I'll explain why, all right? What happens is, as a med student, okay, you bury the emotions, and it can lead to poor decision-making, okay? Now, what they used to tell us, rational, superior to emotional. Well, you know what? We tended to forget that emphasizing medicine is as much an art as much a science, okay? So you do have to have emotional logic, but it should not predominate rational logic. That's very, very, very important that we begin to understand that, okay? Now, the other thing is that medical students go on to become doctors, okay? And as medical graduates, they struggle to, lead, okay? And as clinicians, okay? Now, traditionally, what happened was, at directly and indirectly at various levels, I said in internship medical school, where they were indoctrinated. Now, finally, emotions. They do assist in making decisions, okay? So you have to know how to make a balance between both, okay? Rational and emotional. Okay, now the relevance in the clinical context. Now, in a clinical perspective, we've been hearing that, doctors don't care about patients anymore. They're overburdened. They're filling out these templates in the hospital. They're not even caring about, what's going on in the clinic. Okay, it's not like that at all. And that, that they've lost this sense of compassion that they used to have once it was there. okay? Because the patient assumes that sick role. They want, you know, the doctor to be compassionate. And there is this term called compassionate fatigue or burnout, quote unquote, okay? Whereby, you know, you ignore and suppress the feelings of human beings, okay, after a long time, because it becomes so second nature, okay? Repetition, we know, leads to a poor shoulder to lean on. This is somewhat the case, but this is not the case at all, okay? Physicians have to consider a lot of other things. It's also part of the training that is there. And there is a paradigm shift happening now globally with the way physicians are being trained, that they're being trained in more in the art of the communication skills. So you're going to be seeing a lot of this. Now, 5 key elements to EI, okay? Daniel Goleman was an American psychologist, okay? He identified 5 key areas. The first one is self-awareness. The second one is self-regulation. The third one is motivation. The fourth one is empathy. The fifth one is social skills. Now, obviously, you see, emotional intelligence is a skill that you have to master. As you master a skill, what happens when you master a skill? Okay? It improves, okay, with the passage of time. Consistent practice, with accuracy and with precision, makes you perfect, or makes you closer to perfect, I would say. Nobody can be perfect, okay? So the more you do, the better you become, and the better your decisions become as a clinician. So you should actually probably be starting in medical school if you're a med student, then working your way as an intern to practice the skill of, you know, developing your emotional intelligence through these 5 areas, okay? All right. Now, the other thing is that, hold on. Here, self-awareness, okay? Self-awareness, it suffers, you know, the ability to know your feelings, okay, and know emotions, all right? Understand how actions can affect others, okay? This is very important. There's something called kinesthetic learning, okay? What is that? Hand to mind. What you can do is you can have a diary. Now, we know our patients carry these diaries for their blood pressure, their blood sugar at home, okay? Why not have a diary about, your own feelings, okay, at the end of the day? We've forgotten how to write diaries, so actually what you do is you have a diary there, you write it down, what your feelings are. When you write with your hand, it registers in your mind. Your eyes will be able to know. Remember, eyes don't necessarily only see objects. They actually help you work in situations, okay? The other thing is slow down, okay? That's the pace, all right? What happens is a lot of people, what they're doing is they're going like, 1,000 miles an hour, okay? So that's the thing here, all right? So you have to begin to understand that if you don't slow down, you're not going to be able to be rational, okay, when it comes to using that emotional logic. That's very, very, very important. Next is self-regulation. You got to stay in control, okay? And this is self-control, okay? The attacks can be either verbal or physical nature. They have to be avoided or minimized. As a professional, you cannot be engaging in this sort of behavior. It reflects poorly, okay? And it can actually destroy your career. All right, and you cannot make, any sort of decisions that are based on emotional component predominating, okay? Because you are a scientist also, aside from an artist, okay? So basically, also, you got to realize you cannot also paint everything with the same brush, okay? We talk about a lot of tailoring and customization. This is also occurring, okay? That you have to begin to understand that, you cannot stereotype, and you also cannot compromise on values. Goleman said, you also have to be flexible and accountable, okay? You should be, part of this whole process is very dynamic. Now, finally here, improving the process of self-regulation, how does it go about? You have to know the values. You cannot compromise on a value system, okay? Holding yourself accountable. Don't blame others for your mistakes. Accept them. You are a human being made of flesh, bones, and blood. You're going to make mistakes, okay? Finally, practice how to remain calm. Okay, there's this word called anger management, okay? By default of the media, that's where it says how to remain calm always in all these circles. That's just not it. It's also how you are able to handle situations by calming yourself down, okay, beyond anger even. Because sometimes people may cry, sometimes people may begin losing their thought processes, etc. So you have to remain calm, all right? And there are various methods, okay, people use, for example, counting from 1 to 10, timeouts, etc. Next is motivation. You got to focus on the goals for the best outcome, okay? Because success means to go beyond the ordinary. Those people who are goal-oriented and goal-directed, okay, they are the ones who will go to push the bar higher and to go the extra mile, okay? You got to think about, okay, about why am I doing this job. That's the first part of how to improve motivation, right? Okay, and there's a 5 whys technique. You can go Google that on the internet. I simply couldn't just put it over here. It was a bit of time, but I will give a link if people do ask. All right, now know your position. You have to know, are you in a position to lead or not? Okay, you are leading as a doctor, okay, your patients, but are you, a person who can actually lead? Like, for example, if there's a selection to become a chief resident or a chief fellow, are you in that position to be that? I mean, you may not be, because you got a lot of other responsibilities, and you may not, be able to. Finally, you have to be optimistic, okay? Now, those who look at the glass half full, okay, they actually fare better in this day and age, and, rather than those who don't. But you know what? You also got to be realistic. You got to take life with some salt, okay? Being realistic, okay, and not being skeptic is to err on the side, okay, of caution. But I'll pass further any more comments on that. Finally, empathy. We always hear this term, putting yourself in someone else's shoes. Now, it's not easy to do that, okay? Now, it doesn't mean that you go pick up someone's shoes from their, wardrobe and start wearing them. No, that doesn't mean that. It means that you start experiencing, okay? But you have to be humble, all right? Now, those who lead simplistic and basic lives have actually experienced this, okay? Because they have been hardened through tough situations, okay? Now, some people may actually become immune. Others may actually become understanding and compassionate over those sufferings and feelings, okay? And they may step in immediately, all right? Now, academically, this is being stressed, okay, as it's been found to impact professionalism, okay? Now, increasingly, a lot of us are being given, examinations like the PLAB exam, the USMLE, the MCC exams. Now, OSCEs are continuously stressing this. Qualifying medical licensing examinations stress this tool, okay, not just at that level, but even beyond that, okay? They stress it, for postgraduate medical education now, internship and residency, as a paradigm shift is happening as we speak, okay? So you have to go beyond the formative and transformative years of your postgraduate medical education years, okay? And finally, you have to improve your empathy. Change the way you see things, okay? It's called changing your view lens. I'm not going to go over to the optician and say, you know what, change my lens after the optometrist, the ophthalmologist did an eye test. No. It's how you see things, okay? This is just a figure of speech. You have to see the way they see things. Then understand body language, okay? Now, your own body language conveys something about you, but others' body language conveys something about them, okay? All right? If they're biting their feet, they're biting their lips, they're moving their feet restlessly, etc., you're able to understand, that they are actually, bothered by something, okay? And then you can break the ice. I see that you're a bit nervous, you're feeling a bit stressed. That actually can make a world of a difference, because when you look at the devil in the details when it comes to a patient in the clinic, that actually can do a world of a difference between, caring one way or caring another way. Finally, responding to feelings, okay? It's especially important, okay, that you have to respond to feelings, all right? Now, this is very important with juniors, all right? You have to appreciate and you have to find common ground with them, okay, and offering relief, all right? For example, if you're on a night call and, they're not able to sleep, okay, and you need to sleep too, so what do? You tell them, you know what, I understand that you're in this position, okay, I'm also in this position, but you know what I'll do is I'll work with you tonight, and then, maybe we can take some time off tonight, and then you can take some time off as well, and then in the morning, I'll work with you again, okay? Now, this is a term in Farsi what we call husn zain, which means thinking good for others. Of course, there's a song by the Commodores called Night Shift. You can probably listen to that, and that actually does correlate with that. Now, social skills. The best communicators are those who have the best social skills. You want to hear both the good news and the bad news. You don't want to hear either one. I mean, you don't want to be splitting, okay, what they call it in behavioral sciences as one of the mature defense mechanisms. All right, so how do you make it better, this part? Well, conflict resolution. In any Western medical setting, conflict resolution is a very important aspect, okay? Western healthcare systems require you to be a team player. And this is a very good point for team dynamics, okay? Because you have to be able to resolve disputes. Now, improving communication skills, that's part of it too. I mean, you got to be ready to improve your skills with it. For example, I just mentioned earlier on husn zain, okay? It meant not only think, but do good for others, okay? And praising them. equally is heavy in its weight compared to the actions, okay, then that can actually serve a world of a difference to motivate others. Finally, you should obviously just begin to think, in a more holistic manner, okay, when you praise others, okay, that, what will it do and what will be the outcome of it? Okay, so social skills. Now, communication. Okay, the best people who communicate, okay, are those who have the best social skills. Okay, or did I already do that slide? Apologize for that one. Okay, so finally, the 5 that are summed up. Okay, you have to know emotions, how they affect you and others. Then you also have to be able to understand and work with others. Okay, because it's important that you also have to not only think, but say and do. Okay, the more you're able to understand others and work with them, the better the leader you are. Now, time is of the essence. You have to take the time out to do things as with any skill. All right, smart devices and automation. The smart devices, have they made us robotic? Yes and no, okay? Now, there is a huge argument about this going on in various circles. Okay, they have made a lot of tasks simpler, but a lot of other tasks have become more complex. Yes, they've made us more mentally capable, I think, in a way, but they're physically less, okay? We are becoming more managers as we go throughout the day, okay? So we're retaining, the purpose of managing our lives, okay? Well, when you recognize that purpose, we're able to organize, okay? So that's very important, all right? Now, smart devices do help us organize, okay? Because you can actually make a diary in there, you can make entries in there in your smart devices, etc. And video links. For example, if you're with a friend, ask them to see how you are expressing yourself. Now, finally, let's talk about emotional intelligence and artificial intelligence. This is going to be touched on next week. All right, but I'm just going to touch on it briefly. Our lives are becoming much more digital, okay, than they were before. Okay, we've entered the 21st century, a new millennium, a new century. It's beyond belief what's going on. But technology, okay, does help us, okay, and it does ensure that there's no longer an elite who's able to communicate. But it doesn't mean the people who are able to use.
Sorry about this, guys. Dr. Nabil Sami is joining us from Canada, so we have a bit of technical glitches there, but he's summed up this very nicely. So teamwork is important. It's important to acknowledge and respect every member in the team, and that's how you will create a good team that will make everybody's life easier. It's important to update patients on their management and be open and honest with them instead of withholding the information. I think there's a culture in our countries that would try not to involve patients too much in the conversation, but I think we should change this culture because patient deep down will know what's happening even if you are withholding the information. And also look after yourself. If you're burning out, you will not be able to effectively communicate, and you will be bordering on to the cynicism, and you will be exhausted, and you won't be able to communicate with your colleagues, as we already mentioned in various examples. So and just imagine yourself, put yourself in patients' shoes. Sometimes if you don't understand how they can be anxious, they can be angry, because they're going through a lot, and they're very, they really want to know what's happening. So put yourself in their shoes and see how would you expect a doctor or other medical staff to tell you. So that gives you a perspective, a good perspective. So we've got a couple of questions. So thank you very much. I thank you all my panelists. It was excellent talks, raising so many important points. We have a couple of questions here from the audience. Henry is asking that, when there's communication breakdown with the patient, how do we incident as junior doctors? And a similar question from Geeta Mashwari. Sorry if I'm pronouncing your name wrong. Same question: how to incident communication problems when you are a GP?
I think it is important that all kind of incidents are logged somewhere. But again, this is, as I said before, you have to know the sensitivities of the situation. You cannot just start bashing your senior or senior member of the team while you may be wrong. So my advice in that particular situation will be maybe to think, reflect on what happened, there are different ways of reporting the incidents. One is obviously you can, write everything in your own appraisal folder and reflect on the situation and so on. Number two, discuss it with your, trusted friend. What happened, because when we are angry, our judgments can be wrong, and we have to make, all the decisions, and then take everything, and then if there is something going wrong, obviously I will not recommend brushing it under the carpet. We must take action in that situation, but obviously don't make a quick judgment. Okay, so think, reflect, and see what's the best course of action. And sometimes you might have to go to a registrar, another consultant, discuss with the situation, get their advice rather than start challenging somebody very senior.
Yeah, I will add something more, because the question was how we do it in GP surgery. That's what, if I'm not
That's
wrong.
right. Yeah, thank you.
Yeah. I think in every practice, I don't know which level you work, there is a monthly meetings with the other colleagues, and or 3 monthly, and every practice is supposed to discuss a significant event analysis and document it. Okay, so that's what we do, and most of the GP practices do that. I think probably Dr. Ansarayat will second me. Is that correct?
Absolutely. We have it's called DATEX. So it depends how, I think you're supposed to have 1 per 1,000 patients in a year. So if you're a 10,000 practice, you need to have at least 10 to show the quality of improvement.
Yeah.
Thank you very much. I'm tempted to take one more question. It's a very interesting one. Amna Wahab is asking, what does bias mean in Dr. Factor?
That word was in Ansar Hayat's slide. Slides, he mentioned barriers.
The bias is when you have a perceived impression about a pre-perceived, I would say, because suppose if I haven't met you already before, or I've got certain biases about people of certain culture or a religion or a type or any individual. So sometimes we all have biases in a way, but we try to minimize them. But if you have a bias about any particular individual, it might affect your impression of that individual, and then ultimately will have an impact on the interaction, on the communication, and certainly will affect the outcome. So it's very important to have an open mind, a neutral impression, come with an open mind, how can we help today, and genuinely try to help each and every patient, irrespective of whatever their personal worries or agitation or beliefs or how they look like they come from. As a doctor is very important.
I think just to add to that in a practical sense, when you're talking about bias, it goes back to some of the points I was talking about and really being able to listen. I think when you're under pressure because of time, as a doctor, you're looking for the answers very quickly. And as you'll know, especially in general practice, often a patient will present and what they first present with is not actually the problem they want to discuss. And the same goes for any situation, that when you see someone, you can judge them by the way they look, the way they talk, the way they dress. And equally as doctors, within healthcare, other staff can look at doctors, and if you are wearing something a bit more traditional or that's not in keeping with the fashion or the culture of the country you're in, then people can jump to conclusions. And I think that's where the sort of the visual sort of cues can kind of skew your judgment. So be aware of that, have an open mindset, and be aware that actually sometimes you do need to slow things down and ask a few probing questions to really ensure that you are understanding what the context of the conversation is. And again, all these little things lead to effective communication.
Thank you very much. There's a very good suggestion, a question from Abdurrahman Khwaja that we should include this kind of soft skill sessions in our curriculum in the medical schools. So that's a very good idea. And I think there's already work going on that.
Yeah.
So with that, I'm going to ask Dr. Irfan Rashid to announce about the next exciting webinar.
We're doing these webinars for last almost 4 or 5 months. And the next one is going to be my favorite. I will tell you why. When I was a kid, I know most of you remember there was a Knight Rider, and the car drives it on its own. Okay, and I thought I'm in my lifespan, I'm not gonna see any car which will drive on its own. And last month, I went for a car, which I'm probably going to buy. 99% it drives on its own by artificial driving assistant mode or whatever. So this is exactly going to happen. My question is whether in 40 years time there will be any need of doctors for all these robotic stuff, or they will do everything for us, or maybe one doctor is in whole of the city managing all the patients due to artificial intelligence. That is our next topic. Next Monday we're going to discuss the role of artificial intelligence in healthcare system. So I think this is a webinar which especially for people who are from the developing countries. And I went to a healthcare accident show. I've been going for the last 2 years in London, HETT. This is a 2-day show which they run on healthcare technology. Outstanding, amazing. Okay, so we're going to discuss few things about artificial intelligence in healthcare next weekend. So stay connected with us. Okay.
Yeah,
So
thank you very much, Irfan.
Sorry, go on.
No, thank you, Irfan. But it looks very exciting. I am excited to attend that, actually. Emotional intelligence and other things as well.
I think at least our jobs are saved for the next 10, 20 years. I don't know what will happen after that.
Yeah, 20 years. Thank you. Yeah. Thank you.
So Dr. Hafiz, can I ask you to please conclude the session? Thank you.
Right, to all the panelists, inspiring talks, Dr. Ansar Hayat, Dr. Masood Ahmed, Dr. Nabsami. There were a bit of technical issues. We know we are running a little bit late, but the panelists have put a lot of effort and time in terms of putting the presentations together. And we thought even if we run a little bit late, it is important that we, give the message which we really want to. There's no way we can cover this topic in 1 hour. Each of these panelists can speak for hours, and each of these areas can be unpicked further. However, this is just the beginning. I think we recognize there's a huge need in terms of taking communication forward. So we will come back to you with more topics, within communication in terms of, unpicking. People are asking, for example, a few questions I've seen: how do you empathize with the patient who's in ICU? How do you deal with the patient who is angry and shouting at you? I mean, obviously, the words have power. Okay, do not underestimate them. And number one, recognizing them early and taking action early is the key. And there are words which you use to diffuse the situation. I think we are going to come back on that. I think there is going to be a separate webinar on body language. There's going to be a separate webinar in terms of just dealing with the angry patients, knowing what is happening and what's being reported in the media recently. However, I will say, if you're watching us on Facebook or if you're watching here on the Zoom, please do share our stream. It is an excellent topic. And I think there are a lot of people who were working, who couldn't join the live stream. If you share on your own timelines, then it will reach to them, and a lot more people will benefit definitely from there. Do tag your friends, like. In the end, I will say words have the power, and they can destroy you or heal. Okay, it's the way how we use them. With that, thank you very much, all of you, for watching the webinar, and all the panelists. Thank you, Jazakallah.
Thank you very much. Thank you.
Hafiz.
Thank you, Hafiz.
Thank you.